Hi, my name is Oladapo Oyebode. I'm the corresponding author for a paper titled Persuasive Mobile Apps for Health and Wellness, a Comparative Systematic Review. The outline of my talk, I will be discussing the motivation behind this work, the research goal, methodology, result, highlights, conclusion, and future work. Motivation behind this work. Mobile health apps or mHealth apps employ persuasive techniques, consciously or unconsciously, to influence their users to adopt a target behavior, such as engaging in physical activity, healthy eating, anxiety and depression self-management, and so on. To the best of our knowledge, most previous research investigate the persuasiveness of mHealth apps targeting a specific health domain, such as physical activity, mental health, and so on. Therefore, it is necessary to conduct a comparative review across multiple health domains in order to uncover new and useful insights. So the goal of this research is to conduct a comparative systematic review of 80 mHealth apps across 4 domains, namely physical activity and fitness, diet, emotional and mental health, health assessment, and healthcare. Specifically, we identified the persuasive strategies employed by the various apps and how they were implemented, and then compared them across the 4 domains. Reviewers coded the apps using Persuasive System Design Framework, popularly known as PSD model, and Cialdini's principles of persuasion. Our approach involves 3 main stages. First, we developed a Python script to extract mHealth apps on Google Play using keywords relevant for each domain of interest. For example, we used keywords like fitness, physical activity, exercise, and so on to extract apps in the physical activity and fitness domain, while keywords like diet, food, nutrition, water, and so on are used to extract apps in the diet domain. Next, we select 20 most popular apps from each category or domain based on number of installations, average ratings, and number of reviews. So 80 apps were selected in total. Finally, 3 reviewers knowledgeable in persuasive technology field coded the apps using the PSD framework and Cialdini's principles of persuasion, as mentioned in the previous slide. 32 persuasive strategies were used to code the apps. We discuss these strategies in the next slide. These are the persuasive strategies we use in coding the apps. Under the PSD framework, there are 28 strategies divided into 4 categories. Each category has 7 strategies. For instance, under the primary task support category, we have reduction, tunneling, tailoring, personalization, self-monitoring, simulation, and rehearsal. The Cialdini's principles of persuasion has 6 strategies as mentioned in their paper. However, we selected 4 of these strategies because 2 have already been captured in the PSD framework. The 4 strategies include reciprocity, scarcity, social proof, and commitment/consistency. This diagram shows the process the reviewer followed in coding the apps. First, they installed the apps on their mobile phones, which are Android-based. Second, they used the features available in those apps to perform various tasks. Next, they took notes of the persuasive strategies employed in the apps, and now those strategies were implemented. They record their findings in the coding sheets given to them. Finally, the reviewers collate and discuss their findings. In the next few slides, we will discuss the results of our comparative analysis. The current slide shows the primary task support strategies employed by the various ML apps across the 4 domains. From this chart, it is clear that personalization is the most employed strategy across the 4 domains, followed by self-monitoring. As previously mentioned, personalization is the most employed strategy across the 4 domains, followed by self-monitoring. We also found that tailoring is mostly employed by apps in the physical activity and fitness domain. Simulation and rehearsal, however, are rarely employed by apps in the 4 domains. This chart shows the dialogue support strategies employed by ML apps. Reminder, suggestion, and liking are mostly implemented in apps across the 4 domains in varying degrees. For instance, the reminder strategy is implemented by 17 out of 20 apps in the physical activity and fitness category, while 19 diet apps employ the strategy. Also, only 7 apps employed the strategy in the health assessment and healthcare category. From the previous chart, it is obvious that reminders, suggestion, and liking are mostly employed across the 4 domains. Another interesting discovery is that social role is mostly implemented in health assessment and healthcare apps compared to apps in other domains. In this chart, we compare the system credibility support strategies employed by ML apps across the various domains. It is interesting to see that all 20 apps in the physical activity and fitness domain employ the trustworthiness strategy, closely followed by diet domain with 19 apps implementing the strategy. More importantly, we found that more than 15 apps in each domain employed the surface credibility strategy, making it the most employed strategy across the 4 domains. In summary, surface credibility is the most employed strategy across the 4 domains, followed by trustworthiness and reward field. Expertise strategy, however, is least employed by emotional and mental health apps, as well as apps in the health assessment and healthcare domain. Research has shown that most mental health apps fail to disclose the source of their content and also lack clinically validated and evidence-based content. This chart shows the social support strategies employed by ML apps. It is obvious that more social support strategies are implemented in physical activity and fitness apps and also in diet apps than apps in the other 2 domains. From the previous chart, the competition strategy is the most employed in physical activity and fitness apps. Interestingly, almost all emotional and mental health apps, as well as health assessment and healthcare apps, did not employ social support strategies. This is not surprising, since most patients like to keep their health issues private. Overall, few apps employed social support strategies across the 4 domains. Finally, this chart shows the Cialdini's principles of persuasion employed by ML apps. It is obvious that commitment/consistency strategy is mostly employed by physical activity and fitness apps, as well as diet apps. As mentioned in the previous slide, commitment/consistency is mostly employed in physical activity and fitness apps and also in diet apps. This is not surprising since most users commit to daily or weekly fitness and dietary goals and work towards achieving them. We also found that commitment/consistency strategy is the only strategy employed by health assessment and healthcare apps, though only 4 apps are involved. Regarding how the persuasive strategies are implemented in the apps, this slide shows 2 sample strategies and how they are employed across the 4 domains. In diet apps, for instance, users are provided personalized contents depending on their demographics, height, weight, or location. Also, health assessments and healthcare apps use personal information to assign doctors to users or patients. For reduction strategy, users have access to predetermined lists of exercise or sport types, as well as training plans in physical activity and fitness apps, so they don't have to create a new plan from scratch. We also ran a bivariate Pearson correlation experiment using XPSS to determine if a relationship exists between the number of persuasive strategies an app employs and its effectiveness based on average ratings. Across the 4 domains, it is clear that no relationship exists since the correlation coefficient is close to 0. Let's look at some of the highlights from my findings. Here we show the top 3 dominant persuasive strategies, as well as the least dominant persuasive strategies. It is clear that personalization is the most dominant strategy in all 4 domains. Personalization is the most dominant strategy in health apps. Of course, in this era of precision medicine, personalization becomes critical in order to tailor or fit healthcare to individual patient or user. Also, software credibility's dominance in emotional and mental health, as well as health assessment and healthcare domains, can be linked to the sensitive nature of these issues. So patients determine credible apps based on how professional and aesthetically pleasing they look and how responsive they are. Also, self-monitoring's dominance in physical activity and fitness apps can be linked to advancements in mobile and ubiquitous computing, with the availability of sophisticated sensors in both smartphones and wearables to track movements in real time and from different angles. It is also obvious from our findings that only 21% of ML apps employed at least one of the 7 social support strategies. So app designers need to leverage human social nature by providing features that allow users to invite their friends to perform target behavior together, compare performance with others in order to keep themselves motivated, learn from other users' success stories or challenges, and also team up with other users in performing a healthy activity. It is important to note that users should still be allowed to preserve their right to privacy when using these optional social features. As previously mentioned, we found that there is no correlation between the number of strategies an app employs and how effective it is. This means that it is possible for an app to employ fewer strategies and still be effective. This aligns with a research conducted by Orji et al. In 2017, which shows that persuasive apps that employ a single strategy can still be effective. In conclusion, our comparative systematic review produced important insights, one of which shows that personalization is the most employed strategy in ML apps. As part of our future work, we will conduct a broader review that involves additional ML apps from both Google Play and App Store. We also plan to investigate and compare the effectiveness of apps employing multiple strategies with those employing a single strategy. These are some of the references. Thank you.